The physical neurological exam consists of 6 different sections. First is the mental status, in which you'll include an overall assessment of their level of consciousness, their affect, their orientation, and their mental abilities. Next, you'll move into the cranial nerves, and for the purpose of this video, we're just going to include the cranial nerves on our final head to toe. So for cranial nerve 5, you'll have the patient clench their teeth and you'll palpate the jaw. For cranial nerve 7, you'll have the patient wrinkle their forehead, puff their cheeks out against resistance, and then close their eyes against resistance. And then for cranial nerves 2, 3, 4, and 6, you'll look at their visual field by having them follow a pen light and then also looking at their pupillary response. For cranial nerves 9, 10, and 12, you'll have the patient open their mouth, stick out their tongue, and say ah. And then for cranial nerve 11, you'll have the patient shrug their shoulders against resistance. And then next, you'll move into the motor function section. First, you'll look at the overall symmetry of the upper and lower extremities. And then next, you'll assess the strength and tone by looking first at the range of motion, and then you'll also test resistance against you for their strength. And you'll do flexion, extension, abduction, and adduction for the upper and lower extremities. Next, you'll move on to the reflexes. There's 5 deep tendon reflexes that we'll look at, which is biceps, brachioradialis, triceps, patellar, and Achilles. You'll take the reflex hammer and you'll strike the reflex or the tendon, and you'll see the appropriate reflex response. And then you can also observe superficial reflexes as well. And then next, we'll move on to sensory function, which is 6 different tests. First is the light touch, in which you'll touch a patient with a gauze and they'll tell you where they felt it. Next is pain sensation, which you'll use a pin and you'll have the patient decipher between sharp and dull. Next is the vibration sense, in which you use a tuning fork, hold it on the patient's fingernail or toenail, and have them say when they feel the vibration and when it stops. Next is proprioception, in which you'll move their distal phalanx up and down and have the patient say what direction it's going in. Next is tactile location, in which you'll touch the patient in 2 different spots and have them point to where you touch them. And then last is the discriminative test, in which you'll have 2 pins and you'll touch the patient and you'll have them say how many pins they felt. And all these tests are done with the patient's eyes closed. And then last is the cerebellar function section, in which includes 5 tests. First, you'll do the finger to nose test, in which the patient will touch their nose and then touch your examiner the finger. And then next is the heel to knee, in which the patient will bring their heel to their knee and slide it down their shin on both extremities. Next is the rapid alternating movement, and they'll do this as fast as they can. Next is the Romberg test, in which the patient will stand with their eyes closed and you will observe for swaying and unbalance. And then last is the gait assessment, in which you will look at their normal gait, walking on their heels, walking on their toes, and then tandem walking. And then that's the end of the physical examination for neuro.